Hi, Dr. Vicky here. So, how do you figure out in a complex case what's going on? So, let's use an example of one of my patients that comes in and they have chronic shoulder and neck problems. So, you have to ask a series of questions as to what might be going on. Did they have head trauma? And if they did, then that leads to a series of questions that can lead to something that is brain-based. If you have limited range of motion and you have different types of symptoms in the shoulder and neck, you have to ask another series of questions. So there's a lot of different scenarios that go along with how to handle these types of conditions. And one of the things that's important is not in every case is an adjustment appropriate. So, and a lot of times people will go and they'll get adjusted, and then 2 days later they have to go get adjusted again, and then 2 days later they have to go get adjusted again because it doesn't hold. So there's a situation where, do you have instability going on? Why is it only lasting for a day or two? So you have to ask a series of questions as to what's going on. Did you have a whiplash injury? Did you have a head trauma 20 years ago that could be contributing to this? So you have to ask a series of questions about the musculature, range of motion. You have to ask brain-based questions to kind of sort through and figure out. It's not always an easy task to go in and make an adjustment, but if you're not healing the area properly, then you have to consider maybe that there's other factors involved. And so that's what we do at Sauder Chiropractic. So if you've got chronic pain and it's not going away, or if you go in and you're not, the pain is pretty much there all the time and it gets better for a little while, let's talk about it. So give me a call at 303-385-3432 or sauderchiropractic.com.